Yes, good morning to all. In the previous classes, we have discussed the first module related to the introduction to health psychology, and here we are trying to, or we are going to move to the second module related to health psychology. And in the previous module, we have discussed what is health psychology or definition for health psychology, and what is the need and significance of this branch. What are the need and significance of health psychology, and we have already discussed related to the mind and body relationship, how it come into existence, and the models like biomedical model and biopsychosocial model also we have discussed, and we try to given how the psychologists work and how it is being effective, what is the branch of health psychology deals with. So these all things we have discussed in the first module, and moving into the second one, it is all related to health behavior and primary prevention. So here we are going to discuss about health behaviors and health habit, and what are the changing health habits and attitude changes, and how it contributing to mental health promotion or health promotion and primary preventions. And there will be some of the methods or models to be developed, or some of the approaches we can see by the upcoming module. So let's discuss, we can start the discussion related to the health behavior and primary prevention. So we have started with an introduction to the health behaviors, and what is health behavior, and what are the role of behavioral factors in making diseases or illness. Okay, so the first one we have to discuss about the introduction to health behavior, and the first factor, that is the role of behavioral factors in diseases and disorders. So in the past century, a decline in acute infectious diseases due to changes in public health standards, but there has been an increase in the preventable disorders, including lung cancer, cardiovascular disease, alcohol and drug abuse, and vehicular accidents. So we can see that in the past century, the infectious disorders are getting into declined, just because of the changes which are happened in the health standards. So we know that we came across with the biomedical model and biopsychosocial model. So when it comes into the biopsychosocial models or biomedical models, it is the development of the technologies happen. So they change into bring out the public health standards. So due to that, the infectious disorders are getting declined, but there has been an increase in the preventable disorders like lung cancer and cardiovascular disease, alcohol and drug abuse, and vehicular accidents. So these all are preventable disorders, so it can be prevented by the person itself. The role of behavioral factors in the development of these disorders is clear. So we can come to conclusion that there will be some behavioral factors in the case of preventable disorders. Some of the behavioral factors plays an important role in the preventable disorders, and nearly half the death in the United States are caused by preventable factors, like with smoking and obesity and problem drinking being three of the main causes. So mainly they noted that these are the main three causes for making some of the problems or disorders or illness, just because of some of the preventable factors, including smoking, obesity and drinking problems. So these are the main causes for these are the behavioral factors in the reason for development of these disorders. Health behaviors have been defined as the overt behavioral pattern, actions and habits that relate to health maintenance, to health restoration and to health improvement. So the health behaviors, how it is been defined, that it is the overt behavior, that is outside behavioral patterns with the person, or actions or habits that related to the maintenance of health, because how the actions or the following habits of that person, it is related to maintaining a good health, and to yes, it is also leading to health restoration and to maintaining or improving the person's health. So it was some of the definition given by Goshman in 1997. Yes, a variety of behaviors fall within such a definition, including smoking, alcohol use, diet, physical activity, sexual behaviors, physician's visit, medication adherence, screening, and vaccination. So these all are some of the uh, overt behavioral patterns or behaviors that fall into such cases, including the definition for health behaviors. And we can see the activities or overt behavior of the persons, like smoking, behavioral patterns like smoking, using of the alcohols, and no proper diet or physical activity, and sexual behaviors, and visiting the physicians or doctors, medication problems, and vaccination issues or screening. And these all are the some of the behavioral factors or overt behavioral patterns that you can see with fall in that group. Health behavior is an action to maintain, attain, or regain good health and to prevent illness. And this is also a definition which is given for health behavior. So it is an action to maintain or attain or regain good health, and also to prevent the illness or promoting the health. And some common health behaviors are exercising regularly, eating a balanced diet, and obtaining necessary inoculations. So it is we have mentioned some of the overt behavioral patterns in the previous slide, and these are the some of common health behaviors that you can see for developing or promoting the health, that is exercising regularly, eating a balanced diet, and some obtaining some necessary inoculations. Here we are going to give an overview related to the health promotion. So we believe that the study of health behaviors in both healthy and unhealthy population is an important area where health psychology can and has made important contributions to improving health. So when talking about the area related to both healthy and unhealthy people, health psychology can do something related to the contributions of improving the health strategy or health behavior of the people. And health promotion is a philosophy that has at its core the idea that good health or wellness is a personal and collective achievement. For the individual, it involves developing a program of good health habits. So when talking about the health promotion, so it becomes the idea that to attain or to attain the good health both physically and mentally, or the psychological well-being or the wellness of the person, and also the personal and collective achievement of that person. So these all areas all together leading to the health promotion of the individual. And for the individual, it involves developing a program of good health habits. So in the case of health promotion in the personal level or in the individual level, so it is they have to develop good health habits. And for the medical practitioners, health promotion involves teaching people how to achieve a healthy lifestyle and helping people at risk for particular health problems offset or monitor those risks. So in the case of medical practitioners, their duty or their wellness is to promote the mental health or health promotions, or teaching the people how to achieve the healthy lifestyle, and also help the people who are having at the risk of any of the health problems related to that. And also they have to monitor these risks what the people are having. And when it comes in the case of the role, when we are taking the role of a health psychologist, how they will be promoting that. And health promotion involves the development of interventions to help people practice healthy behaviors. They will be playing with the behavioral pattern of the people, or for the development of the health promotions. And they will also make some of the they'll development of the interventions to help or to understand the people how to practice the healthy behaviors. And for the community and national policy makers, health promotion involves emphasizing good health and providing information and resources to help people change poor health habits. So it is what the national agencies, or it is being done by the family welfare department or the health departments, like making some of the policies, national policy makers, that or the community level workers, social workers, that they will be promoting the health promotions through providing the informations and resources to help people to change the poor health habits. So here we have a good example for that, the problem what we are facing right now, that is the COVID-19. So here the national policy makers are making some of the standardized rules to go through the people, or the uh, individuals has to be go through some of the policies, like some of the rules and regulations to be followed, and it also be done to maintain the health promotion, that is to avoid or to change some of the poor health habit of the people, like cleanliness. So you have, in the current situation, the promoting the good health, and that is using sanitizers or some wearing of the mask. So these all includes some of the uh, policies that the policy makers are being done in the community level to change or to promote the health. Yes, the successful modification of health behaviors will have several beneficial effects. So behavioral modifications in health areas, it will have some of the beneficial effects. It will be followed. That is, the first one, it will reduce death due to lifestyle related diseases, and it will help to reduce the death rate related to the lifestyle diseases. And the other one, the second one, it may delay time of death, thereby increasing life expectancy. So when new or some of these modifications are being done in the behavioral patterns or health behaviors, it will be beneficial that it may delay the time of death, and also leading into and increasing the life expectancy. And the third one, and most important, that is, the practice of good health behaviors may expand the number of years during which a person may enjoy life free from the complications of chronic disease. So this is one of the important and most good beneficial effects related to the modification of behavioral patterns, that is how much the time the person is being living, and he can also avoid or he can enjoy his life at its most concern, and by avoiding some of the complications related to making some of the chronic diseases, avoiding such chronic disease, and he can leave the person at what time, or he can also live without any tensions or from the complication of chronic diseases. So it is a uh, result of practicing of good health behaviors.